Did you know that there are non-medication based treatments for ADHD that actually work? Most people think about stimulant medication like Adderall or Ritalin when they think about ADHD, but there are other options out there. And in today's video, I want to share with you a few methods that we use in our practice to effectively treat ADHD without the use of medications. And if you've not been here before, let me quickly introduce myself. My name is Matt. I'm a therapist in private practice. I own a group practice and we specialize in treating people with ADHD. We specialize in DBT and some other issues as well. You can check out our website for more information. But with that out of the way, let's jump right into today's video. Now, I have to start by giving just a very simple definition of ADHD. Now, it is important to know that ADHD is extremely complex. It's actually difficult to define, popular to contrary belief. But ADHD is a neurodevelopmental disorder that can affect anyone at any age, and it affects every facet of a person's life. Some common symptoms people talk about: distractibility, forgetfulness, issues with emotion regulation, difficulty concentrating, irritability, procrastination, lack of motivation, and this kind of stuff. But if you want to know a lot more about ADHD and what it is, I'll leave a link down below to a video by Dr. Russell Barclay that goes into a lot more extensive detail. This video is certainly not to say that non-medication is better than medication or vice versa. I am simply just highlighting the fact that there are non-medication based treatments that are effective. And this video is not medical advice. I always advise people to talk to a medical professional if they have any questions about medication or anything like that. All right, so then what are the non-medication based treatments that are actually effective in treating ADHD? In our practice, we use 4 primary methods of treating ADHD. The first one is DBT, which stands for dialectical behavior therapy. This was a method of treatment developed by Dr. Marshall Lenehan in the late 70s or early 80s. It was originally designed to help people with borderline personality disorder. However, since that time, it has shown to be effective in treating a variety of other issues. It has become a very popular evidence-based treatment for very good reasons. One of them being that it just simply works well. Now, DBT is broken into 4 main segments. There's emotion regulation, distress tolerance, mindfulness, and interpersonal effectiveness. Now, underneath these 4 main modules, there's a variety of skills and tools that are taught and learned. It's also important to know that there's a lot of overlap between the symptoms of ADHD and borderline personality disorder. In fact, I made an entire video just about this topic. I'll link it down below in the description. I'm not saying these disorders are the same, but there are similarity in the symptoms that present. And with that in mind, it makes sense that DBT also helps people with ADHD. Let me just give you a quick example. The one common issue people deal with when managing ADHD is emotion regulation. People often say that they have intense emotions, it's hard to control them. And so when we teach skills from the distress tolerance section of the DBT manual or from the interpersonal effectiveness section of the manual, people with ADHD benefit greatly from learning skills to regulate emotions. And so this just works really well. It's a perfect fit. And it's very important to know that DBT is very actionable and tactical. It's tons of skills and tools. So when people leave sessions, they have something to practice, to learn. There's worksheets and homework. And this is really, really helpful for people with ADHD because it's not necessarily about ways of thinking all the time, but it's more so about how do we practice different skills and tools that are really going to help me with my symptoms like procrastination or emotion dysregulation. And these skills and tools can be used daily to help improve the symptoms of ADHD. It's pretty cool. Another modality we often use is called ACT. This stands for acceptance and commitment therapy. Now, we use this more as like an underlying theme in our therapy practice because at the core of ACT, what they're really talking about is how do we live in alignment with our core values. And what ACT says is that many people fall out of alignment with their core values in how they live day to day, which leads to a lot of issues and distress. Let me give you a quick example. Let's imagine that I have a core value that I want to be a really good father to my children. Yet I struggle with drinking and I find myself drinking to deal with stress every night. As I drink every night and deal with stress, I often miss important family functions like my daughter's basketball game. And now in this example, we have someone who's living out of line with their core values. They want to be a good father, yet their drinking is causing an issue there. They're not able to be the father they want to be because this has become a barrier. ACT is going to help us tap into exactly what our core values are. And then once we identify these core values and how we want to live, we then work on how we go through a version so that we can live more in line with our core values. So for example, if I wanted to be sober so that I can be more present as a father, I have to deal with the difficulty of becoming sober, which can be really, really challenging. And so ACT is going to help us get through those challenging circumstances so that we can then live in alignment with our core values. And one thing that I know from my experience in working with people with ADHD is that they often deal with a lot of impulsivity issues. And this can lead to a lot of problems living out of line with their core values. For example, maybe they want to save up for a home that they want to purchase, and instead they bought tickets to a concert last minute because they just really wanted to go. And in this regard, ACT therapy is going to help us learn skills and tools to not impulsively buy things so that we can save for a home. This is just one example, and you can see how ACT therapy could be really helpful for people dealing with ADHD to get them to live more in line with their core values. We also use CBT therapy. Now, it's important to know that cognitive behavioral therapy is not going to be helpful in terms of actionable and tactical skills and tools to help executive functions and day-to-day functions, but what CBT is really good for in terms of ADHD management is undoing the shame and guilt and low self-worth that does build up as a result of living with ADHD. So for example, a lot of people with ADHD have a lot of shame around forgetting things, missing things, letting people down. And so they sometimes have this mindset that they will just always let people down or they'll always fail. Thinking becomes very black and white. And so what CBT does is it helps us identify maladaptive thought patterns, and it helps us then identify more adaptive thought patterns that help us live more in line with the truth of things and not so much the distortions that we have in our mind. And then finally, we also engage in executive function skill building. Now, this is not a therapy technique per se, but it's more so just skills that we teach to help people improve upon executive functions. Now, there's nothing mind-blowing about this, and executive functioning is actually a very complex thing. It's actually hard to define it. Russell Barclay wrote an entire book titled Executive Function or Executive Functions. I'll leave a link to it down below. But essentially what executive functions are, it's a person's ability to set goals and then achieve those goals. That's a very simple definition. Let me give you a quick example. So we might have a goal to go to the store and buy bread, right? And now in order to buy that bread, there's a couple things we need to do. First, we need to be future oriented. We need to be able to plan for that trip to the store. We need to remember what we want to buy, right? We need to manage time. There's just a lot that goes on between making a decision to buy bread and actually buying the bread. And those sets of skills that help us achieve those goals, the memory, the planning, these are executive functions. And people with ADHD deal with poor executive functioning. So there are skills and tools we can teach that improve upon executive function. I hope you found this video helpful. I hope you learned something. And until next time, I look forward to seeing you soon.